So little was known or heard about the health management organizations or health maintenance organizations, HMOs, in Nigeria. A lot was known about HMOs in Nigeria when the National Health Insurance Scheme was launched precisely in 2004 in Nigeria. Since then and now, at the beginning, at the initial stage, we had, call it just a minimal 8 HMOs accredited to work with the National Health Insurance Scheme. That number moved on to 66 as of 2012. And as we speak, the accredited HMOs in Nigeria is about 77. Well, whether they have done well or not, it is the National Health Insurance Scheme to say. Today we are here to talk about health management or health maintenance organizations. My guest is a stakeholder and a key player in that sector of the health value chain, Dr. Korie Chukwuemeka. He is the MD CEO of Managed Health Care Services Limited. Thanks for joining me on Insight. HMOs, is it health management or health maintenance?
Health maintenance organization.
Okay, so what is it all about?
Yes, a health maintenance organization is a managed care organization. In fact, the acronym Health Maintenance Organization came up first in America around 1973, when there was need to define a kind of healthcare coverage that would provide care for the larger majority of the people. So that acronym came into place for the first time around 1973. It is an managed care organization that provides both health insurance and medical services to a group of people who select them for health insurance coverage. It tends to provide health care to people at most cost-effective price. That's the essence of a HMO, okay. To ensure quality, to ensure that cost of medical services are appropriate and people have value for money.
Okay. Now, by the definition I have, it says it's a private or public incorporated company that is registered by the National Health Insurance Scheme to only manage the provision of public healthcare services through healthcare facilities that are accredited by the scheme, which agrees with what you said.
Yes.
Now, beautiful. Within Nigeria, or in Nigeria, would you say the HMOs have done very well?
Definitely.
Convince me or convince us.
Now, you see, let us look at the space we are playing. It's interesting to know that HMOs came into existence before the National Health Insurance Scheme.
Give us information.
The act that brought National Health Insurance Scheme into existence was signed in 1999. Our organization, Managed Health Care Services, came into existence in 1998. And so many organizations came into existence before us. We were providing health care to Nigerians, and our focus was the organized sector. You recall, earlier than in the 1990s, 1980s, what was key was retainership. So when the HMOs came into play, they were taking over the healthcare services of organizations, moved it from retainership to health insurance, a situation where a company can now have a fixed budget for healthcare. A company can now say, for this year, 2017, I'm going to spend 100 million naira for healthcare, and it's 100 million. Unlike what was happening before, where it was open-ended. They kept spending. Also, organizations then, their staff, some of them will take health expenditures from their salary if they see a certain limit. Health maintenance organization came and had to put that to an end. That once someone is enrolled into the scheme, that person has access to medical care. The organization will not have to deduct money from the staff. These two things alone moved productivity in organizations. You can know when you now provide health care for your people, productivity increases. Okay. And also, before that time, hospitals were being owned. by organizations. A lot of organizations, we are owing them a lot of fees in retainerships. But when health maintenance organizations came into play, we tend to solve that problem. And also there was so much fraud. People employed by organizations, we now have to extend that same medical care to inappropriate people. People that weren't, so the organizations are paying for medical care for people who are not in their employment or their dependents. When health maintenance organizations came into play, we had to put that to an end because we have to provide that health care to the fixed number of people that we are paid for. And that same thing will transmit to the hospitals. Now, a hospital, you have 100 people who have asked you to treat. It is these 100 people you are going to treat because payments will be made to you on the basis of that, those 100 people. And the hospitals are now meant to share the risk of health care. You see, health insurance is all about risk sharing. The health maintenance organization bear the risk, the hospitals also bear part of the risk. So the providers, the hospitals, now share the risks with health maintenance organization. This risk sharing mechanism help to kick off fraud, help to kick off people who are not appropriate to receive care. Okay, and also did one other thing. You see, there is a kind of, if a doctor is going to deliver care, health insurance, health maintenance organization emphasizes one thing. It emphasizes necessary medicine, appropriate and necessary medicine.
Okay, let me hold you there. Because, like I said, I want to, as much as possible, stay off the feud between HMOs and the National Health Insurance Scheme.
It functions like that.
Top management of the National Health Insurance Scheme feels that HMOs in Nigeria have failed Nigerians. Is that true?
I don't think so. Because what is actually happening now is a reflection of failure to move. That 12 years ago, when we started the National Health Insurance Scheme with the formal sector, if you understand the concept of universal health coverage, or if you look at the objectives, let's look at the objectives of one objective of the National Health Insurance Scheme is to provide affordable medical care to all Nigerians. But what we've done for the past 12 years is to provide health care to a segment of Nigerians that we are paid for by the government. It has not been escalated. And we do know very well that countries that want to attain universal health coverage, that want to do it, will have to attain it using mandatory insurance scheme or using tax revenues to provide it for all their citizens. But here, we have a segment of people. And when you have cover a segment of people, there are certain consequences. Okay. One, because you are dealing with small numbers, administrative fees will be high. Two, a large number of people will not receive that service. Three, you will be quite ineffective. So that's the outcome of what we're. So it is the failure of our nation to move from the step we made 12 years ago to where we should be 12 years after. Okay. You remember, the scheme initially tried to include other people, apart from this set of people that we are paid for. Okay. They now try to include women, pregnant women, and children under 5 through the MDG projects. It wasn't sustained. Okay. So you find out that the situation we are facing now is a reflection of our failure as a nation to move from covering a significant population of the people to a larger proportion of the population. I'll tell you this thing. If, for instance, we had moved to cover more Nigerians, which is not within the powers of the HMOs to do so, it is they provide.
Can the HMOs go to scout for clientele?
Definitely, that's what we do.
Are you doing that correctly?
Yes, and we find out that that's the point I wanted to make to you. When we go to scout for clients, who are our clients? Those who can pay. What happens to those who cannot pay? So our clients are similar to the ones being covered. So we look at it is the upper people, the employed people that are being covered. We have a large middle, and the vulnerable people
that are not covered. To have the a prospect of Nigerians covered?
Beautiful, simple. let's look at what other countries are doing. Because we don't need to reinvent anywhere. Let's look at countries like Indonesia, Thailand, Venezuela, Brazil, even United Kingdom, other places. How have they tried to improve on wider coverage of their people? Or even our sister country, Ghana, because at times we make references to Ghana, we make references to Malawi. Now, let's look at these people. What did Ghana do? Ghana made provision because healthcare must be paid for. Because when we say these things, we forget one fact, that healthcare must be paid for. Who pays for it? And how do you pay for it? That's what we are talking. Healthcare financing. How do you finance the healthcare of your nation? One, it must be adequate financing. If you are looking at the larger population, you have to look at it two ways. Okay. You do it by tax, like it's being done in Ghana. VAT. Every person provide that tax. Every person that is a citizen will have access to care. Or you make it mandatory. If you make it mandatory, health insurance is mandatory in Nigeria. Every person that is working contributes. Every person that can earn money contributes. And we pull that fund and use it to take care of the vulnerable.
Put forward by the National Healthcare Insurance Scheme is, from inception, what they uploaded in terms of beneficiaries has remained there. HMOs have not done anything further to add to it. Is it true?
It is true, because they paid for a specific number of people. Let's be specific. I don't want to enter that controversy, but I'm talking as a Nigerian.
You cannot avoid it because
yes,
it's like
I'm talking as a Nigerian. Yeah. As I told you earlier, that the policy, when it was implemented, started by a selected group of people. That policy have not moved from that selected group of people. And whose responsibility is it to move it from those selected group of people? It is not the health maintenance organizations. This is a political decision.
Okay. So coming back to expanding it, you talked about tax. Safeguards, how do you handle it? Because tax, in terms of being regulated, how will those who are not capture points be involved?
Okay, it's simple. You see, I told you that the health insurance thing, escalating it, the issue of universal health coverage is a political decision. Okay. If our politicians, like I know, they are very much interested in health. Okay. If, as a political class, they take a decision today, like politicians in other places, I think Indonesia, Taiwan, even United States, you can see how health is a burning issue that determines the future of politicians. If our political class today come together and agree that first of all we have to move this forward, and how do we do it? That's the first thing, legislation.
Yeah, it's good to have a legislation which will be a guided compulsion.
Exactly. So, and that legislation will make provision for source. How do you finance healthcare? The legislation will define how the healthcare will be financed, either by general taxation or by value-added tax, or by what is being done by a section now, what we are doing by contribution from staff and contribution from employees, or whichever means it has to be defined. And if that is defined, and we now know that this is something provided for all Nigerians, we recall it is to achieve this that the National Health Act stipulated that all Nigerians should have access to basic health care, I think by 0.5% of so part of the consolidated revenue of the Federation. That is the essence of this, because a step had been taken. So it's a political decision. So, and implementing it also is a political decision. Health maintenance organizations, as you said earlier, they are privately owned organizations. Just like we have banks, just like you have insurance companies, just like you have pension funds, you have all those things. And if we are marketing, look for those who can pay for your services. And currently, as I speak to you, It's not every health maintenance organization that is handling the National Health Insurance Scheme.
Okay.
There are about 64 registered HMO. It is not all the 64 that have handling the formal sector lives of the National Health Insurance Scheme. Many of them are dealing with other people that are not the federal civil servants of Nigeria, and they are in business. Who are they covering? Nigerians who can pay. So what we are doing,
what happens to those who cannot pay?
That is what we are saying, that those who cannot pay, who will pay for them? That's the question we have to ask. Who will pay for them? They cannot pay, but who will pay for them? They are our citizens. That's why I told you that health insurance, universal health coverage, is a political decision. And it is only the highest politician of the land that can move it forward. In places where it has worked, it has been the highest of the presidents. Okay. It is not even the minister.
Okay.
Because it is the president.
Yeah, you have emphasized on that only.
Yes.
I also ask the question, is it about number or a reduced size of quality service? Because some persons feel that the number of HMOs in Nigeria is just too much. In countries where it is working and results are achieved positively and we could see it, we don't have as much as these HMOs. Is it true?
It is not. You see, this is a business.
And people are going to the business because of the money, not the service. A lot of persons are going to not because of the money, not because of the money, not because of the service, but because of the money.
Business because of money, not because of service crumble. And those of us who are in the business because of service, we've been there for years. Our interest is service. If you go into business because of money, we are not going to last long. It's a short-term thing. What can sustain your business is service. And then the number of HMOs in Nigeria, we're a country of more than 180 million people. And I think all Nigerians come into the scheme.
Of what value will it be if we lose HMOs or we have them in the system?
Okay, presently as we speak, if we lose HMOs now, all the companies, all the organizations that we have been providing services to, it will no longer be there. And what more, the stage we are in our development, in our march towards universal health coverage, you remember it's a march. Private health insurance is important because we are serving as supplements.
So how come
we are standing in for what the government had not provided?
Okay.
Is a natural progress. Okay. We are standing in providing health insurance for individuals who are not presently covered by the government or by the other form of scheme. Okay. So that is the role we are playing.
So how come the National Health Insurance Scheme, which is supposed to be the regulator, is saying currently that if they have their way, they will do away with HMOs? Is that possible?
You see, they can decide to
is that possible? Is it doable?
Yes, but it does not stop the operation of health insurance, HMOs, as a business.
Okay.
All it might do is that the government, the businesses that concern government, that they find a way of doing it, but it does not eliminate private health insurance. Okay. And the truth is this, is that in future, when private health insurance cannot, this is one truth, private health insurance is not a pathway to attain universal health coverage because it addresses only a few. If we are going to address, if we are looking at universal health coverage, a time will come when those of us as operators of private health insurance will now operate what we call supplementary services. We are not going to provide services above what the national scheme may be providing.
Okay.
For instance, if the national scheme cannot provide for complex surgery, you come and pick up insurance with us. We will give you access to complex surgery.
Okay, as a last word, why must I, as a Nigerian, imagine I'm a Nigerian and I stumble on Dr. Korie Chukwuemeka and I say, why must I use HMOs and without me just walking to the clinic, pay my money and I move on? Convince me.
Yes.
That's the last word.
Out-of-pocket medical expenses impoverishes people. Health insurance is a poverty alleviation measure. It saves the family. It saves the individual for catastrophic expenditures. It gives you access to medical care 24 hours with or without money. And what more? It ensures you receive quality care. Okay. Because most times when you receive care, you are not sure what you are receiving. But health maintenance organizations stay there to ensure that the services you receive, they are quality care. Because if they are not quality care, they will pay the provider and may not pay. And providers are conscious of this, and then they provide the services according to the Ghana. But the most important thing is this, is that it is known all over the world that out-of-pocket medical expenses is one of the factors that drives poverty. Okay. So health maintenance organizations are providing services that are in line with poverty alleviation. And that is exactly what we are doing. And that's why we are vital.
Okay. Thank you so much, Dr.
Thank you.
Korie Chukwuemeka, MD/CEO, Managed Health Services Limited.
Thank you very much. Thank you very much.